Okay, now for our next topic we have is rickets or osteomalacia. طيب. What you guys need to know is that rickets and osteomalacia are literally the same disease. Osteomalacia is the referred disease to adults, while rickets is for children. Okay, now to understand rickets and osteomalacia, we need to understand what vitamin D did. As in semester one, you guys took vitamin D and what it did and its function in the biochemistry section. But a recap is simply vitamin D helps in the reabsorption of calcium from the kidneys. It also helped in the calcium absorption from the intestine, and it also helped in the calcium bone resorption. We break down bone to allow calcium. The main objective of vitamin D was to do what exactly? To increase the amount of calcium in the blood. Okay, that's the main objective of the vitamin D. Okay, so in rickets and osteomalacia, what we have is a deficiency in vitamin D. There is not enough vitamin D, whether it's from supplements, whether it was dietary. Okay, the person right here cannot or doesn't have enough vitamin D. Okay, now what does this lead to? Simply to a decreased amount of calcium. صح? Very simple, very easy, straightforward. Okay, so there will be a reflex, there will be a bodily response. And what is that? It's by secreting PTH. And again, PTH, as we know, is one of the hormones that help increase in the amount of calcium. So what is the PTH doing here? Trying to increase the calcium. Okay, but if there isn't vitamin D or enough vitamin D, then the PTH isn't gonna be able to return the calcium back to its normal amount. Because vitamin D has a bigger role in calcium homeostasis than PTH. Although PTH allows vitamin D formation, vitamin D is the main player. It's the main thing that allows calcium to come back to normal. So a decrease in vitamin D will surely mean a decrease in calcium. So less vitamin D, less calcium means increase in PTH. And as always, you need to understand that PTH always decreases the amount of phosphate. Right? So the phosphate in our body will decrease. Okay? So these four findings, which is a decrease in Vit D, a decrease in calcium, a decrease in phosphate, and an increase in PTH, okay, as well as an increase in ALK phosphate or alkaline phosphatase. Now we can actually talk about what this molecule is. Simply, these molecules are produced by the osteoblast to allow for a more alkaline environment. Why? Because osteoblasts love to work in alkaline environment. And why would you want that? This is because in rickets and osteomalacia, we don't have enough vitamin D, so we don't have enough calcium. So the osteoblast is worried, so therefore it wants to overwork itself by forming an alkaline environment. Therefore, it will keep producing the alkaline phosphatase, so it can keep and it keeps forming bones. But the main problem is it doesn't even have calcium. Okay, so it just produces the alkaline phosphatase to help bone formation, but in the end, if you don't have calcium, you cannot do that. Okay, and therefore you have rickets and osteomalacia. So these are the 5 lab findings that you will see in rickets. Okay, a decrease in vitamin D, a decrease in calcium, a decrease in phosphate, an increase in PTH, and an increase in ALP. You see, for now, I would say you should memorize this because later on, actually in year 2 in the endocrine section, when you learn about the parathyroid hormone and its pathologies, you will take more into details the different lab findings and what it indicates and what disease it tells you when you see these different lab findings. Okay? But for now, for your stage, you don't need to know that. Okay? Finally, in X-ray, we will find a bowing of the leg as a finding for rickets in children, and that's it. That's it for rickets. A very easy and a very straightforward disease.